Jacob Brindle here with Heart of Texas Physical Therapy. I'm going to be addressing a question that I hear very often from patients is what is vestibular rehab and what can physical therapy do to help me with vestibular rehabilitation. So vestibular rehab is treatment of patients with vertigo, dizziness, and balance problems. Vertigo and dizziness and balance problems affect every aspect of your life. You can have a sensation of spinning whenever you roll over in bed, whenever you lay down, whenever you stand up, whenever you're walking and you turn your head too fast, you can feel vertigo or dizziness, balance problems, people who have chronic fall problems, things like that that make it very challenging to go about your day-to-day business. So a few definitions. Vertigo is the sensation or the illusion of the world or yourself spinning. It can last seconds, minutes, days, or even weeks. I've seen some patients suffering with vertigo, depending on the condition. Dizziness is more defined as a sensation of being off, or dizziness with blurred vision, especially when you're walking or turning your head too fast or driving. Or I hear very commonly people who spend a lot of time at their computer screens and they have difficulty focusing or difficulty reading for extended periods of time. Vertigo is actually 50% of cases in individuals over the age of 65 and is typically caused by a mechanical issue in the inner ear of the vestibular system that can be resolved most of the time in 1 or 2 visits depending on what the condition is. Dizziness more typically is from a longer standing condition and is usually after the vertigo has subsided. People are left with a sense of dizziness or disequilibrium. You can also be very motion sick and motion sensitive. Dizziness is actually the third most common complaint to physicians. Less than 50% of those patients ever receive a diagnosis. Less than 10% of those patients ever see a specialist like an ear, nose, and throat physician, and far fewer than that 10% actually are sent to see a certified physical therapist for the treatment and rehabilitation that they desperately need to return back to life and restore their normal function. If you've ever answered yes to questionnaires when you go to the physician's office or speaking with other healthcare professionals, if you've ever answered yes to have you in the past or are you currently experiencing dizziness or vertigo or balance problems, bottom line is that you probably have a vestibular disorder of some kind that is highly treatable. In fact, 85% of the time, symptoms can be resolved in less than 30 days. So bottom line is physical therapy treats the underlying condition. It doesn't just mask the symptoms. Traditionally, medication, a very specific medication by the name of meclizine, it goes by other trade names, but typically has been prescribed for patients. It's over the counter as well. The difficulty with this medication is that it only masks the symptoms, and it actually makes it very difficult for your brain to compensate for the problems. And it basically causes an endless cycle of dizziness when what you need is rehabilitation therapy to address the underlying physiological problem. Once again, thank you so much for watching this video. If you have any questions or concerns, don't hesitate to call me at 254-981-3238. Thanks.